the day number 2.
Health Practitioners, Replacement of Statutory References to Medical Practitioners Bill, first reading.
The Honourable Dr Jonathan Coleman.
I move that the Health Practitioners, Replacement of Statutory References to Medical Practitioners Bill be now read a first time. I nominate the Health Committee to consider the bill. This bill will amend 7 statutes to enable a wider range of suitably qualified health practitioners, as defined under the Health Practitioners Competence Assurance Act 2003, to undertake certain functions currently restricted to medical practitioners. In response to changing healthcare needs, the manner in which our services are delivered is changing. The emphasis is shifting to delivering new models of care and better services to patients closer to the communities in which they live. In response to this, the health workforce is evolving. Many health professional groups are now capable of performing tasks that were previously the sole domain of medical practitioners. In the future, healthcare will be delivered by multidisciplinary teams in an integrated team environment. Health professionals will be supported to practice to the full extent of their skills and to engage in collaborative, evidence-based practice that delivers high-quality interventions for patients. Expanded scopes will be more common and innovative practice will be encouraged. These trends in healthcare service delivery will have significant benefits for patients. Such benefits include improved patient experience, early access to preventative health care and, where necessary, early intervention, and greater availability of healthcare services closer to people's homes. In addition, patients will have a sense of a continuum of service delivery where health practitioners have a common understanding of patients' healthcare needs and are able to make more timely and appropriate interventions than at present. Mr Speaker, current legislation does not support the new direction for the healthcare workforce. The amended statutes will enable health practitioners with the required competencies and knowledge to perform certain statutory responsibilities lawfully under those statutes. There are currently 7 statutes that allow only medical practitioners to undertake certain functions. Other practitioners are unable to perform them. This bill, if approved, would enable more health practitioners to undertake some of the functions currently limited to doctors. More services could be delivered in the community rather than in hospitals, and patients' access to services will be improved. The bill will not pose an increased risk of harm to the public. Each health practitioner is required under the Health Practitioners Competence Assurance Act to perform only those tasks that are within their scope of practice. Scopes of practice and the qualifications that practitioners must obtain in order to perform tasks within each scope of practice are set by the relevant responsible authorities that have been established under the Health Practitioners Competence Assurance Act 2003, such as the Nursing Council, the Psychologists Board and the Pharmacy Council. Although it has been a long time in the making, the amendments are a welcome change as they recognise and enable a greater range of health professionals to work together to deliver safe and timely services to the people of New Zealand. I'm advised, Mr Speaker, that although the initial work to identify legislative barriers originally considered the potential contribution of nurses, given the significant role that nurses play in healthcare service delivery, however, the proposed amendments will also enable the potential contribution of other regulated and suitably qualified and experienced health practitioners, particularly in the primary care context. Mr Speaker, I'd like to provide some examples of where this bill can make a real contribution. The Holidays Act 2003 allows only medical practitioners to provide proof of sickness. The Accident Compensation Act 2001 limits who can participate in claimants' rehabilitation plans. The Land Transport Act 1998 states that only medical practitioners and optometrists can provide medical reports on persons unfit to drive. The Children, Young Persons and Their Families Act 1989 restricts medical examinations of children by medical practitioners the court considers qualified for the purpose. Amendments under the bill will extend these duties to appropriate health practitioners other than doctors, such as nurses with the appropriate knowledge, skills and training. The government relies on competent, suitably qualified health professionals in the health sector and supports expanding the role of nurses, pharmacists and others to improve health service delivery. This bill will contribute to making the best possible use of our available health workforce. Mr Speaker, by enabling more health practitioners to undertake the functions currently limited to doctors, there will be real benefits to patients and their families. Changes to the Mental Health Act 1992 will allow health practitioners other than doctors to request patients under their care to have further assessment or treatment by their medical practitioner when required. This change will enable health practitioners involved in mental health care to more easily refer patients under their care for medical help. The bill amendments to the Misuse of Drugs Act 1975 will enable suitably qualified nurses to treat drug addiction, where unfortunately there is a growing need. With the passing of this bill, it will also mean that nurse practitioners caring for patients will be able to certify the cause of death under the amended Burial and Cremation Act 1964. That change is especially important in rural areas and aged care services. Currently, where there is not an available medical practitioner to certify the death, there may be unnecessary delays for family and whānau to be able to move their family member from the place of death for burial. This bill means that current arrangements for certifying death will be more in line with what happens overseas. For example, in the United States, registered nurses have been able to sign death certificates since 2004. Mr. Speaker, I'd like to acknowledge the contribution made by the nursing sector in the creation of this bill. The Ministry of Transport, the Ministry of Social Development, the Ministry of Innovation, Business and Employment, Accident Compensation Corporation, Police, the Ministry of Justice, State Services Commission and the Treasury have also been involved in the development of the bill. So you can see there has been quite extensive and wide input. Mr. Speaker, I commend this bill to the House.
The question is that the motion be agreed to. The Honourable Annette King.